Hi, I'm Holly Tanner with the Herman Wallace Pelvic Rehab Institute, and I'm here with my friend and longtime colleague, Tina Allen, and she is going to tell us a little bit about the manual therapy for the abdominal wall course. So, Tina, can you start by just telling us a little bit about your background and experiences and what you're doing right now?
Got it. So, Tina Allen, I'm out here in Seattle, Washington, and I've been a therapist. I'm in my 30th year, believe it or not, and I've been treating pelvic rehab, just pelvic rehab solely for the last 25 years at least, I think. And currently, and probably for the long term, I'm at the University of Washington working within the pelvic health clinic there, the pelvic health center. So it means I get to work alongside our urogynecologist, our GI docs. So just a multidisciplinary clinic. And then we treat all things pelvic health. And I've been teaching with the Institute. I don't even know, Holly. I don't remember. Yeah, it's been a long time, at least 15 years. Could
Mm.
be longer. Not really sure. And and that's who I am. I've been involved in some research, and then I treat all genders throughout their lifespan, and all pelvic health conditions.
Mhm. And one of the things that has been fairly unique to your experiences and what you've offered the field is that you get to pull these providers into your treatment room and give them a real look at what it means to be a pelvic health provider. Can you just speak briefly to that?
Yeah, I mean, one of the things I've been back at the University of Washington for 10 years, and one of the decisions that went into me going back to the University of Washington and working there is that I have residents with me just about every week learning about what we do. So, and that was one of the choices I made going into a medical system was that I wanted to teach our physicians what it is that we offer and how we are part of the team and how the group of us help, meaning the physicians, our physical therapists, our rehab professionals, help the patient along in their journey. And so they get to learn more about their muscles. I will say that most of our residents don't get to leave their residency anymore without being able to fully state all the amazing functions of the pelvic floor.
Good. That's amazing. And can you tell folks a little bit about this course here? What can participants expect to get to do with their hands, with the person's body with whom they're working, and what kind of skills do you like them to be able to practice when they go back to the clinic?
Yeah, this class really came out of helping people learn about their hands better. It came out of teaching the series for a number of years and really feeling like we gave them such great information. But then some folks are just getting started touching the body in this way. And so this course is really about taking some of those skills that we learned maybe a long time ago or maybe never learned, and then really applying it to the abdominal wall and the delicate tissues that are the abdominal wall. So they get to learn and we review how everything interplays within the fascial system, the myofascial system of the abdominal wall. And then we apply specific techniques such as how to assess the tissue for mobility, how to treat tissues that are restricted in the abdominal wall, how do we treat scar, how do we help somebody who maybe can't lay flat because their abdominal wall has been restricted for so long because of possibly pain, possibly due to surgeries, possibly due to some fear, right? And so then how do we help those patients treat and get back to function?
Mhm. And what kind of feedback do you get from participants? Can you think of just some really positive feedback in terms of how they feel this fits into their clinical practice?
Yeah, when I've taught this class, I hear from all skill levels. So this is a beginner level class. You do not have to have taken any other coursework before taking this class. But the class is usually filled with absolute people just starting on their pelvic health journey. Maybe they're waiting to get into a pelvic floor one class, and my really experienced clinicians who've been doing it a while and take the class to see if there's something new. And I hear from everyone that they leave the class and they're ready to start using those techniques right away on Monday. So it's
Mhm.
immediately applicable into the clinic their first day back.
Nice. Where do you feel like manual therapy fits into the big picture? I think there's two sides of the spectrum, and of course, oftentimes we like to fit somewhere in the middle, right? That middle path. But I find on one end of the spectrum is the folks who say, "Don't do manual therapy. It makes patients dependent on you." And people who've experienced trauma you shouldn't touch them because it re-traumatizes, it should never hurt, and on and on. And then other folks perhaps only ever do manual therapy and don't always integrate the lovely pieces, whether it's movement therapy or breathing, mindfulness, all of those pieces. So, where do you fall on that spectrum in terms of recommending manual therapy approaches for clinicians to use with their patients?
Yeah, great question. Because it's true. Where do we fall with that? And I'm definitely a middle of the way person. I feel like using our hands, asking for permission to touch,
Mhm.
and then using our hands helps the patient integrate into their system again. They may not realize that they've been holding, that there's tension or rigidity in the tissues. And if we live next to an airport, we don't hear the planes after a while. If we've been holding our muscles tense or we've been guarding an area for a long time, we may not realize that anymore. So to me, manual therapy fits in to help folks realize or feel what's happening in their body again, and then allowing them to make that change. So, this area, usually it's more that a patient gets done with a session, that the manual therapy part of our session, and they're going, oh, I'm moving different now we work on during the remainder part of our treatment session of, now let's move better with that new range of motion, that new awareness you have. So it's this component. So it's not all or none, that I only use manual therapy or that I only use exercise, that I use manual therapy to allow patient to move better, become more aware in their body.
Mhm.
So truly is that middle way.
And I'm hearing some great clinical pearls as you even give your explanation there. Do you find that although this class is going to be really heavy in techniques and skills, that you also get the opportunity to dialogue with folks and to answer those kinds of questions that have these clinical pearls throughout?
Yeah, definitely. So there's a pre-recorded lecture, and then there's another lecture that we do, and then we actually go into lab. And there's techniques, and then there should be somebody with you to practice on, or you can practice on yourself and I can watch, right? And then we do a treatment session, and then we do case studies. So we take those, what we just put together, and think about some actual patients that I've seen and worked with, and integrate it together. And then there's also plenty of room for people to ask questions about a patient they may have,
Mhm.
or an experience they have, or how do I maybe address this. So really trying to integrate it into, integrate into the whole treatment approach. There's also a section we talk about home program. What does a home program look for with a patient after including these manual techniques? How does a patient carry it over to home?
Mhm.
Yeah.
And Tina, of course, you're delivering this and put a lot of thought into what does this look like over Zoom. And it seems that a lot of folks do really well when they simply have another body that,
Mhm.
with consent, they can work on during the class so they can try something that they visually get to see and hear an explanation about. And then they can ask their questions to you.
Right.
That's going to be really nice.
Right, and I have the techniques videoed, right? So people can actually see the technique, and then hopefully they can have somebody accessible to them during that session. I purposely put the labs together right before lunch where you would need somebody, so hopefully the amount of time you need somebody available is put together so that then the other person can get on with their day.
You bet. Fantastic. And one thing that a lot of folks don't know is that when you and I have had the opportunity to teach side by side before, that people can't tell us apart. And so before the interview started, I grabbed my glasses just so folks, so we can really confuse folks, right? So
Exactly, which one of us
so
are?
I'm Holly and that's
I'm Tina.
Tina.
Exactly.
And we might not have taught your 2A in Texas that one time. That may have actually been
I know.
the other one of us.
Right. When we taught together, I would just get used, when I wasn't teaching with you, I would get used to answering to Holly.
Mhm.
"Holly," and I'd be
Mhm.
like, "Yeah, sure, what's
Here
up?"
I come. It's great stuff.
I know.
Well, thank you so much, Tina. I know a lot of people are really excited to have this course back in full force and offered by Zoom, and that people are going to get a lot out of it. So, thanks again for taking some time to tell us about your course.
Thank you so much, as always, Holly. Thank you,
You bet.
thank you.